G'day and welcome back to the channel. So in today's video, I've turned to Reddit and more specifically the back pain subreddit to hopefully answer some questions and to draw some inspiration to talk about some of the common misconceptions about back pain, some of the things that a lot of people could be doing in regards to their back pain that they might be missing, and give my take and my perspective on a lot of these things that you may be going through if you have back pain yourself. So our next post is by someone who says they're 10 days outside of a laminectomy, but they've mentioned that they've still got pain going from their hip to their ankle, and they're worried. Is it going to get better? It's a tricky conversation for a lot of people because the natural thought process that a lot of people go through is, did I just go through this surgery for no reason at all? And ultimately, being 10 days post back surgery, it's still obviously relatively soon after for a lot of people. And it can take, 3 to 6 weeks for a lot of people to start to feel fantastic or to start to feel more human again post back surgery. Now, obviously, everyone's back surgery is different, but whether it's disc surgery, whether it's a laminectomy, whether you've had a fusion or something like that, it's obviously really important to talk to your therapist, talk to your surgeon, to make sure that what you're feeling isn't abnormal in the context of what you're going through. Obviously, it's normal to experience some degree of discomfort post-op. Obviously, the duration of your back pain before surgery has a real impact on how long you might be uncomfortable for post-surgery. A lot of other things like the quality of the surgery, where the surgery was, how physically fit and healthy you were. So obviously how good you were going into the surgery, again, can dictate how well you feel after the surgery. But ultimately, it's an exercise in making sure that you are communicating with the people that are helping you through this. There might be something you can do from your GP in terms of tweaking your pain medication. There can be some things that you can talk about with your physiotherapist, your physical therapist in regards to certain exercises that you might be able to do or not do. The nuances of each of these things can really help balance out your pain. And one of the things that's always important to explore is, for anyone who's soon post-op, if it starts to get to the point where you feel like you're physically recovering from the operation, you're moving better, but your pain is staying similar, then it's really important to have that conversation to explore what might be going on. So next we have a post by W Bishop 836. In the post, they mentioned that they've been having low back pain and hip pain for almost a year now. The reason why I think this is an important topic to discuss is because they mentioned that they've had a lot of different therapies, a lot of different treatments, and a lot of different diagnoses as well. And this is really important because it speaks to the idea that it can be very tough as someone going through this for a number of reasons, one of which is the information overload. It starts becoming this question of, well, who do you trust and what piece of information is the right piece of information? And in these moments, it's really important to start to sort of, not dumb it down, but to condense this information into things that you feel make a difference. We want to base things on results. So if someone pushes on a joint in your back and you start to feel a connection to your pain and a resolution in that pain, then clearly you can sort of have some confidence that that is something you need to take seriously. If you take a specific medication and you don't feel that has a genuine impact on your pain after a reasonable amount of time, you can start to ask the question of your doctor and start to explore the idea that potentially the thing that they're treating isn't what's going wrong, or that the pain medication they're giving you isn't the thing that you need to take. You can start to sort of filter out the things that you feel are working and the things that aren't. And you can start to take that information and relay that back to your relevant medical and health professionals so they can start making more refined and better decisions on your behalf. Again, it's very hard for you as someone going through back pain, going through a lot of different issues, to start to figure out what you need to do because you're not quote unquote an expert. You haven't necessarily been through this before, so it's hard for you to know who to trust and what information you need to trust to get you to where you need to be. If you, like a lot of people, are dealing with some low back pain and hip pain, I would want to make sure that the base of your rib cage, the top of your lower back, isn't horribly stiff and tight in some way. And if I'm pushing through your back and it starts to increase or decrease your low back and hip pain, then we can start to have confidence that that's potentially where it's coming from. But ultimately, it's really important to keep an open mind. It's really hard when you've been going through pain for a long time and you've had a lot of people say a lot of different things, but really trying to understand what you need to do to fix yourself. But you're becoming more and more of an expert in your pain, and you should feel comfortable telling the people that are managing your conditions what you felt worked, what didn't work, and then trying to take a step back and analyze everything around that as well so that you're not missing something going forward. afterwards. So our next post is by someone of the name NoPin698, and they just mentioned that they need a little bit of advice and encouragement dealing with the suspected disc herniation. And the reason why I wanted to talk about this is they mentioned that they wanted some words of encouragement, some other things they could be doing to speed up their recovery, because they're obviously not looking at surgery and things like that. So they also mentioned that the mental part of this journey has been the hardest part for them. And I think it's really important to acknowledge how tricky back pain can be mentally, because it really rips you from being someone who is just going about living your day-to-day life. And in a lot of instances, it sort of forces you to become someone who needs to sacrifice things that you enjoy doing, or it doesn't allow you to do the things that you want to do that make you happy. At the very least, the presence of pain, persistent pain, can really take a toll on you and those around you. So, you know, if you're someone who's dealing with a recurrence, something that went away but's come back, again, we need to make sure that you're not focusing too heavily on what it is that you're actually dealing with. We obviously need to respect that and need to pin that and say, well, look, you've got this pain in an area. It could be a disc pain, it may not be. But when you get a recurrence, what that tells me generally is that the thing that caused it the first time is still there under the surface. It's causing it a second time. What we're often looking for here is, again, the same boring stuff that we want to talk about for most back issues. We want to look at how stiff your hips are, how stiff your middle back is, how good is your core strength and core activation. How are you positioning your back day to day? So are you someone who has to sit at a desk all day? Are you someone who is on your feet all day, but when you get back onto the couch, you're in this really slouched, hunched position, consistently putting your back and the tissue of your back into a position and a scenario that it can't tolerate long term? What I always advise people is, once you feel fantastic, it doesn't mean that everything's perfect, it just means that things aren't sore anymore. So we need to make sure that you develop this thinking of trying to analyze the shapes that you're in consistently, make sure that you address some of those hidden stiffnesses or hidden weaknesses through your glutes, through your trunk, that may have sort of led to this becoming a problem in the first place. But ultimately, if you've been through it once and you've gotten through it once relatively well, then there's a high chance you're going to get through it a second time, and it's just a matter of keeping sort of the right mindset and being aware of what things you need to focus on going forward. Next, we have a post by Direct Enthusiasm 445, and they talk about back cramping. And the things that they're trying aren't necessarily making a difference. Now, obviously, if it's a cramping-based feeling, we tend to default to the idea that it's a muscle cramp. But what it can also be is it can be a joint in your back becoming irritated. And it's a bit of a spasm or a jolt of pain or a sharp jolt of pain that's reflective of that part of your body feeling threatened and irritated. And this is a really good topic of conversation because it speaks to what you can do to control pain in the moment. We can start to look at things to decrease that threat perception, to decrease the pain consequences that you get. So something like deep breathing, whether it be a box breathing or just taking a deep breath in and then relaxing, trying to sigh on the way out. Heat packs can be hit and miss for a lot of people, but if there are some stiffness and some tightnesses around that area, or if you feel like your tissue is heightened and on edge, a heat pack on the area can be a good way to get that nervous system to feel more safe and to decrease the severity of the pain consequences that you're getting. If you're looking at your back cramping or back spasms as a muscular issue, then depending on what it is and what's going on, that spasming and that cramping is happening as a direct response to something else, which in most instances, in my experience, is an underlying dysfunction, most commonly joint dysfunction, but it can be maybe a disc bulge underneath or an irritation or an inflammation of some tissue going on there. So it's really important to keep that in mind when you're addressing that dysfunction. And again, a great way to get rid of muscular spasm or muscular cramping is with the ball. You can gently let it press in, let it stay there, take some deep breaths, get the ball to sort of gently press into that. Over time, your body will give, it will release a little bit, kind of like trigger point therapy. But what I would always suggest for anyone is that make sure that you're double checking both sides. So if you have one point where you feel like there's a really tight, solid bout of muscle spasm there, just make sure that underneath that, the joints are actually stiff. Because if there is some joint stiffness around the other side, that joint stiffness could be the mechanical dysfunction that's annoying the opposite joint and asking that muscle to tighten. So just make sure that you are looking at both sides of the coin, freeing it up, but also making sure there's no other dysfunction there. You can get ahead of that dysfunction so it doesn't want to keep sort of tightening back up again. So our next post is by AP Killer B, and they mention that it hurts to breathe in deeply, and they're wondering what it means. Now, This generally for most people, whenever you take a deep breath in and you experience some pain, from a physio perspective, this can often mean that the joints of your rib cage, those costovertebral joints, the joints where your ribs attach to the front and the back of your spine, are becoming overloaded and irritated for a certain set of reasons. So even if you're getting some pain when you breathe in at the front, generally it tends to be a consequence of the dysfunction at the back, or the rib joints as they attach into the back. We tend to think of most issues as a muscular issue, and there can be muscular dysfunction involved, but the majority of people tend to have muscular issues that are a result of deeper joint dysfunction, where those joints have become stiff, tight, and overloaded. The body's recruiting those muscles if it's starting to feel a bit threatened, and sensitizing the area if it's getting to a point where there's some real threat being perceived there by your brain and nervous system. Again, ultimately, we need to have a talk about your postural habits. If that upper back is becoming stiff, tight, and tender, it's very likely in a lot of cases that we're rounding and losing that good shoulder position, that good shoulder posture that is causing that to become overloaded, things getting weak, things getting stiff. And then when you start to take a deep breath in, as soon as you breathe in far enough to include the joints that have become dysfunctional, if they feel threatened enough, they can have a tendency to become painful and sore. So always putting yourself into a better position to make sure that that stuff doesn't want to come back again going forwards. So the last post that we'll cover here is by someone called Kingsley69. They mentioned 6 sitting postures with the herniated discs that people should never do. I think what's really important to understand here is that there are degrees to herniated discs. So you can have or be labeled with a herniated disc and have a very mild sort of disc bulge. And this can mean completely different things for your expectations going forwards than someone who has a very sinister, severely herniated disc. But also, the context that we're trying to promote with this video is that we need to look at what's going on around your back. So if you have stiff hips, if you have stiffness in your upper back, if your sitting posture's stuck, if you have weakness through your back, you don't have a very good bracing mechanism through your spine, then obviously your tolerance to certain activities or any activities, let alone different sitting postures, can be different based on those characteristics. So if you have a really minor disc bulge, but you slouch terribly when you sit, or your hips are really stiff, and that forces you to consistently hinge through your lower back as opposed to your hips when you're sitting, then obviously this can set you up for failure a lot more than someone who has maybe a stronger bulge in their back, but has developed better sitting habits, more mobile areas around it, better bracing mechanisms and things like that. So I don't think it's possible to say to someone, these movements are going to be bad for you or these positions are going to be bad for you. Again, unfortunately, we need to look at the quality of how you do the things that you do in order to understand how that may offer up any consequences to the degree of disc bulge that you might have. Now, sitting in general isn't fantastic for acutely annoyed discs because as soon as you put your bottom on something, the weight of gravity tends to compress that disc a little bit more. Similarly to anyone who bends and leans forwards, that tends to increase the pressure of the disc, and by extension of that, we can theorize that that may increase the potential for pain and dysfunction because there's more going on there than potentially arching backwards, for example. But some of the main positions that we want to talk about here, and they mentioned this in the post a little bit, is sitting cross-legged on the floor, sitting on a chair, and things like that. So what I wanted to mention about sitting on the floor, I'm a big advocate of sitting cross-legged on the floor. We can plant that spine on top of a really well braced and stable shape, and then that can really help load your back up in a really good position. And if you noticed before, I sat up into a better position. So for me, when I was sort of leaning back against the couch, my back, even though I'm still sitting cross-legged here, my back would have had to have hinged a little bit to meet the back of the couch or the sofa that I'm in front of. And if I had a disc bulge, that may not be nice for the position that your back is in. However, if I'm in a much more upright position, and again, granted I'm not in an acute flare-up position or an acute flare-up stage, then my back might be a little bit more tolerant of this position because I haven't kicked a hinge into that position, which is isolating that disc and sort of feeding into the nature of that dysfunction. In terms of sitting on a regular chair, same rules apply. If you're not cultivating a good shape, the hinge that you might be slouching through might be perpetuating your disky symptoms. It might be overloading that disc, making you feel terrible. Obviously, if you're in the middle of an acute disc flare-up, sitting may not feel comfortable for you anyway. You can lie down or stand up instead. That is potentially a better position for you. So I hope this was a really helpful experience to have. Ultimately, I'd love to do more like this as well. There's so much information out on Reddit, so many different forums. I'd like to cover shoulder pain and hip pain and knee pain. So if there is an injury-related subreddit that you're aware of that you'd like me to do a video on, please let me know in the comments down below. If you found this video helpful, please like the video, subscribe to the channel if you're new. If you got some helpful pointers, consider leaving a super thanks donation on the video. It's a great way to help support the channel, allow me to keep making these videos. But with that being said, good luck, and we'll see you in the next one.